Hi, I'm Chunhui Xu, professor from Emory University School of Medicine. It's my pleasure to be here with Dr. Rong Lu, associate professor from University of Southern California. We are here at the 2023 Basic Cardiovascular Sciences Conference in Boston. And Dr. Lu just gave a wonderful talk at the section of cardiovascular technologies, therapeutics, and bioinformatics. Dr. Lu, would you please describe the work that your team has been focusing on?
Absolutely. Thank you for your question, Dr. Xu. So my research team has been focusing on studying hematopoietic stem cells. Hematopoietic stem cells are the cells that regenerate blood and immune cells in the body. So we're trying to understand how these hematopoietic stem cells are different from each other in terms of their blood production, and also how different hematopoietic stem cells work together in regenerating an overall balanced blood supply.
You have developed this fascinating technology using genetic barcodes to trace the behavior of individual stem cells. Compared with the traditional technology, what are the advantages of this genetic barcode technology?
Right, so the major advantage of this technique that I just discussed at a meeting is that it can provide a quantitative measurement. So it will tell us exactly how much or how many of the cells are regenerated or are surviving the treatment that we're applying. So compared to the prior technology where it used the very insertion site, our technology can recover the barcode more efficiently and more quantitatively. There are also recent barcode design that has more sophisticated features, but our barcode is very simple, straightforward, and easy to use. And another advantage is that this technology can be applied to virtually any mammalian cells because it is delivered by lentivirus. So any cells that are very accessible can be used to apply this technology and study their clonal behavior.
In your animal models of bone marrow transplantation, you have used the genetic barcode technology to trace the differentiation of stem cells, showing heterogeneous production of blood cells from stem cells. How would this finding help improve bone marrow transplantation for patients?
Right, so it is a surprise to us that how different the individual hematopoietic stem cells are producing blood cells after transplantation. So I guess this difference really create a new way for us to think about how to improve this treatment procedure. For example, we may be able to isolate and just deliver the more potent stem cells in the transplantation to improve this procedure. And we may also be able to understand the difference. If we can understand the difference, then we can use their difference, the mechanism that we identify from their difference, to improve the efficacy of the other cells and make them all produce the blood the way we want them to. Or even for some patient, the new mechanism we can identify may also be able to help us to activate the endogenous cells without having to transplant, hopefully in the future.
So you also use this genetic barcode technology to study the heterogeneous response of leukemia cell to chemotherapy. Could you comment on whether this technology can be used to study other type of drug resistance, say in other cancer cells?
Yes, absolutely. So this technology, again, relies on the lentiviral delivery. So virtually any mammalian cells that are very accessible can be used. And really the key is to be able to provide the idea of what fraction of the disease cells can respond to the drug treatment. And also when we think about combination therapy, when we use different drug treatment, combine them, are they treating the same or different clone? I think that would be the key advantage of these clonal tracking technology in the treatment test.
So one last question, could you comment on the potential application of your genetic barcode technology for cardiovascular research.
Yes, absolutely. So at this cardiovascular meeting, I see fantastic growth of cardiovascular research, and also, talk to several researchers about potential applications. I feel there's great opportunities to apply these clonal tracking techniques to try to understand cardiovascular disease, for example, to understand the disease-driving cells, to see how they are different from the other healthy cells, and also to see how they progress, whether they expand and how they expand. And lastly, if we can understand the current treatment efficacy on all the cells or a subset of cells, or potentially think about develop a combination therapy to treat all the cell subtypes. So hopefully we can get better and safer cardiovascular therapy in the future.
Thank you so much, Dr. Lu.
Thank you for your question.
And congratulations for your wonderful work.
Thank you.